Hello, good evening, and welcome to Face Off. Now, the health sector is one of the most important sectors in any country. And in Nigeria, it is taken to heart by everybody, both the practitioners and those who benefit from it. We're looking at the health sector today because a couple of days ago, the Nigerian Medical Association threatened to begin an indefinite strike with several things they laid out, some of them having to do with the improvement of the health sector. But there was one salient issue that some will call ephemeral, but seems to be quite important. They're also asking that only a medical doctor be made the head of the medical team or the head of the medical institution. Would that make a difference? Is that why the health sector has not moved forward? Is it because it's not entirely been led by medical doctors? Are the medical doctors as committed as their Hippocratic oath demands that they be? If indeed they are, why then are they almost always going on strike? Unfortunately, the Nigerian Medical Association could not make it today, but we do have a medical doctor here who's speaking in the capacity of a medical doctor, and as he says, he's also a human life crusader. Dr. Peter Ogunnubi, thank you for coming on the show.
Thank you very much.
And on this other side is a human resource consultant who is bothered that the medical doctors are wanting to take charge of everything and not focus on what they were trained to do, which is administer health services. Mr. Yomi Fawehinmi, thank you for coming on the program.
Thank you very much.
Now, gentlemen, you have 10 seconds each to state your position. And since I introduced you last, we'll start with you.
Okay, one of the assumptions of organizational development, which is a field of human resource management, is that talents exist in the whole organization, and particularly leadership talent. And the argument is the fact that when it comes to leading an organization, you have preponderance of talents all over the organization, and the role of HR in that organization is to ensure that the best fit to run the organization is made the CEO of the organization. It doesn't have to be the most prominent, it doesn't have to be the most popular, it doesn't have to be the most important, it doesn't have to be the most prominent, it doesn't have to be the noisiest, but the person that has the leadership capability to run the organization should be made to run the organization. And what you now see is that as a result of that field of study, over 60% of the CEOs of technical and science and engineering firms in the US did not study engineering, science, or anything. As a result of that knowledge base, you'll be shocked to hear that out of the 6,500 hospitals in the US, there are only 239 led by doctors.
You crossed your 10-second mark, but no problem.
Well, thank you very much. I believe as a nation we should be moving forward and not retrogressing. And I believe as much as possible, when the truth is seen, we should say it the way it is. It's quite unfortunate that a time will come in this country that we'll be debating who is to help the health sector, who is not to help. Because the uniqueness of the health sector is not what anybody can take away. And the patient being the locus, when you talk of health sector, I believe, if I'm wrong, you may correct me, Mr. Moderator, that we're looking at patients. That poor man that comes to the hospital. When he gets to the hospital, the total aim is that he wants to leave the hospital cured of his ailments. So whatever happens from the record, from the laboratory, from the pharmacy, medical doctor, the nursing care, the aim is that this patient should come out of the hospital alive.
Okay.
And that is what doctors heading the health sector knows how to do best.
All right, we'll take a break and then we'll come back and continue with this conversation. Should doctors head the health institutions? You can be a part of the conversation. Send via email, faceoff@channelcv.com, or via the Twitter handle at faceofftoday or at Neota Igbe. We'll be back shortly. Please don't go away. Welcome back. So should the medical doctor head the health institution? Would that make the difference? Would that help in the delivery of the healthcare services in the country? That's the questions, or these are the questions we're asking today. Be part of the conversation via email, faceoff@channelstv.com, or via the Twitter handle, tweet at faceofftoday or at Neotaigbe. So we're back here, and we'll start with you asking the first question.
Okay, I mean, I think one of the things we need to do to ourselves is the benefit of history. At a point in this country, we had the University College Hospital that was established in 1952, the UCH, that's what we call it. And the act that established, the Act of Parliament that established UCH, has clearly specified that that hospital should be led by an administrator. Because the role of the CEO of the hospital is to do administration. And it happened for many years. Within that period of time, University College Hospital in Ibadan was ranked the 4th best in the Commonwealth. And then there was a fight between unions in OAU, teaching hospital, and because of that, the military decided to say, we need to solve this problem. And of course, the way military solve problems is solve it quickly, and they decided to come with a new law, the University Teaching Act, which just introduced a line into the review of the other line saying the person to head the teaching hospital, which is the apex tertiary institution, should be a medical doctor. And that was when the change came. My argument is not whether the doctor should lead the clinic or not. My point is that any organization that decides to turn its leadership to a monarchy, any organization that decides to consign leadership to a group of people just because of what they studied is shooting itself in the feet. And when you ask...
a question,
I'm making a statement because it's important for us to put a context to what we're saying. We did not get to where we are in this country with doctors leading teaching hospitals by reason of reason. It happened as a result of a decree. And I'm shocked that in a democracy, people are referring to what happened in the military as a basis to continue a practice that has not taken us anywhere. That in the US, when Nigerians run to when they are sick, I gave you the statistics, out of 6,500 hospitals that were studied, only 235 are led by doctors. The others are led by health administrators and other professionals. The point to make is that whosoever is best suited to run an organization should be empowered. As much as is a trained professional, as much as has capacity to do leadership and administration, that person should not be made to suffer just because he did not read medicine.
Well, I think you are contradicting yourself. First of all, you have mentioned the fact that best fit. You have to define what you mean by best fit, because business administration teaches that the man with the widest level of exposure, training, should be made a team leader. You're also right by saying out of 6,500, we have 235 headed by medical doctors. But I want to refer you to a study done by a wonderful woman, Amanda Goodman. Amanda Goodall, in 2011, conducted a study from this particular study that he has mentioned. It's from that pool of 235. He looked at the best 300 hospitals in America. And it is clear. You can just go and check it. Journals of Social Science and Medicine. A beautiful study in 2011 that discovered that hospitals that the MDs, the CEOs are MDs, doctors, they perform far better in terms of patient management, in terms of administration and every other thing. It is there in the public opinion. Now, for you to say that before the military administration, there was administrator heading, it is not so. The fact must be put on the table that the act that established teaching hospital was actually done to make provost of College of Medicine to run concurrently the teaching hospital.
To, sir? Which year?
Yeah, even before the decree of 1985, Buhari and the Diagbo decree.
I mentioned 1952.
Now you are talking of 1952. After 1952, before 1952, after 1952, and 1985, the provosts were running this hospital.
No, sir.
So it wasn't the military.
The next teaching hospital after UCH was
University of Lagos. It wasn't the military.
Go and check the original act.
It wasn't the military.
No,
you are talking about original act.
No, but
we have the present act that established the teaching hospital.
Can I ask you a question?
And it puts the hand into them to administrators. Now, what these people are now saying, the administrators, who are provost, could be anybody. And then during the dichotomy of decree of 1985 Buhari, they decided, okay, let us separate the position of the CMD and that of the provost of colleges of health sciences. And that is the situation we have. But I am saying that the hospital is not a profit-making organization. The hospital is centered on patient management. By virtues of training, just as I told you, the Mazim in business school, business administration, except you want to come here in public opinion, You want to tell the market woman, the Okada driver, riders, that, okay, apart from doctors, there are other set of medical team members that have the widest form of training. If you want to say that, then I will rest my case. But if ab initio, by training of a medical doctor that enters any medical school today has already made up that mind, he already knows that he's going through a long journey. You go through medical biology training, microbiology, you go through nursing training, you go through community medicine, you go through, why how the hell? Because they think that you should have, to whom much is given, much is expected. And that is it. Because most of the time,